Chemical peels are a good baseline to start with, a bit like microdermabrasion. Often we find that a microdermabrasion treatment first to sandblast the skin, like we're saying, then a series of chemical peels can freshen up the face and get rid of all that sort of DNA damaged skin that we know is there, as well as improve very superficial fine lines and wrinkles. Addresses some pigment concerns, so if people have got melasma or hyperpigmentation issues on their face, if they've got sebaceous skin conditions, acne scarring, active acne it can be used for. So there's a variety of different chemical peels that we offer in our clinic. Our nurse will usually perform the peel on the patient. Some peels are very much a lunchtime peel and the patient will walk out of here just looking fresher without looking too battle scarred. Some of the deeper peels are offered in situations where you've got a lot more sun damage or a more mature face that is probably looking for a more rejuvenated look as well. But they are very effective and probably underutilised in many aesthetic clinics because they are so simple to perform and quite affordable for patients as well.